All right, so I'm going to go ahead and get started. Well, thanks everybody for joining us today. As got a great program for us. We'll be as we head towards end of the school year. We'll be really talking about our accomplishments in the 24-25 school year and where we're headed in 25 and 26. And we'd really love to get your feedback on particularly our 25-26 plan and what we're proposing. We would love to know what things we're missing in the plan and what new opportunities we should be considering. So look forward to getting your feedback. In terms of agenda, you're going to hear from Vicki here at the top of the hour, just a reminder of our North Star. Mary Jane Van Cleve at the city had to step away for a family commitment. So she's not going to be joining us today, but sends her support and regards. And then after we hear from Vicki, we're going to just spend a few minutes talking about accomplishments over the last school year. We'll spend quite a bit of time talking about our plan, and then we'll open it up for questions and feedback. As always, closed captions or live captions are available. It's a little bit of a different procedure than Zoom. So we've got the instructions there. If you can read that. And then everybody except the speaker will be muted. My colleague Celia McTeague will be monitoring the chat. So if you have questions that come up, please drop them there or comments as we go. The more interactive this session is, the better from our perspective. And then the event will be recorded and shared with participants via email along with the presentation slides. All right, Vicki, I'm going to pass it over to you to just remind our group where we're headed, what we're trying to get done here.
Sure, my pleasure, and thanks for having me and letting me have this role. And I have on Teams on the right side of my screen, I've opened all of the participants' names because otherwise your initials for me. But it's just lovely to see all of you show up and be here to support us and to work with us on this. It's probably one of the biggest thrills of the year is this learning network time and the collaboration work that we've been doing. So thank you for being a part of that. So I just wanted to spend a minute kind of sharing our North Star. I'm going to go a little bit backwards to get to here. It won't take me long. But if you were to look at the Renton School District's strategic framework, you would see that one of our pillars says that our goal as a district is to remove barriers and pursue outcomes that enable all students to realize their potential and to maximize their future opportunities. And so that is a really big task and one that we can't do without the work of our community. And so what we decided that we wanted to do was figure out how we could get to a place where there was sort of no wrong door, that anything that a student needed in order to maximize their potential and their future opportunities, they could access it. And since we as a school system are the place where we have the kids, we want to work with others to make sure that the services are available to them instead of us thinking that we can do all of the services. That's why we want this learning network and the community involvement. So our idea is for the schools and the city governments, et cetera, the community organizations, all of us to work together with cross-sector agencies to do the work that we're doing right now, to develop what services we need to give students access to and how they can get access to those services as seamlessly and culturally responsive and relevant as possible. So that's the goal, and I appreciate you being here. And if you have any questions, I'm around and we'll be happy to answer them in the future.
Thanks, Vicki. All right, so now that we have our compass setting, as Vicki is our captain here, pointing us where we are headed, now we're going to just take a step and really look at how far we've traveled this school year. And our accomplishments are outlined in the 3 categories. So the first category we're going to talk about is our hub services. And then we're going to talk about hub sustainability. And then we're really excited to talk for the first time about some of our accomplishments related to hub subgranting, and we have our first awardee on the call here today that we'll be sharing out. So to talk about hub services, I'm going to pass it over to Davina.
Hi, everyone. Thank you all for being here. My name is Davina again, and I'm the mental health facilitator for Renton School District. And I have the honor and privilege of being able to work in this partnership to do this work. As you know, our initial target population for our hub services is students with behavioral health needs. And so the hub services are in three categories that you'll see here. And so one is social emotional learning, and that's all about helping students understand and manage emotions, building healthy relationships, and make responsible decisions. And this programming is in all of 26 of our schools, serving over 15,000 students. Second is the proactive screening and identification of students through our SB Expert screening, brief intervention, and referral to services or to supports program. And this is in 4 of our middle schools. And this school year, we were able to serve 541 students. Third, we have the referral to behavioral health services for students that need behavioral health care. And so there are 2 ways we refer students to services, and one is through our partnership with Hazel Health, which is district-wide and has served 656 students. And then we also have our Student Health Hub. And so through this is our intelligent matching service and system, and we have that in 9 of our schools with 14 providers on the provider network, and that has served 69 students. A link to our most recent quarterly report will be placed in the chat for more information. I do want to go ahead and pass it on to Vicki, who'll begin sharing about this year's sustainability for the hub.
Thanks, Davina. Yeah, Vicki, if you can talk a little bit about the partnership with the city of Renton. I know that was the big accomplishment for this year with our funding work, and then talk a little bit about our work with the school district to make sure that the work we're doing is connected to the Medicaid in Schools program or the Medicaid administrative claiming work.
Sure, it'd be a pleasure. So, one of the things that I've been extremely proud of is the work that actually I'm going to give Health Commons credit for, that Health Commons has done in connecting us with some of the other sectors in the city so that we're not operating in silos of, the Renton School District and then community partners and then the city of Renton, et cetera. So I think one of their great accomplishments is their ability to bridge sectors and introduce us to the people that we want to work with, the right players, et cetera. So thank you so much for that work that you've done for us and for your introduction to the people at the city of Renton who have done a really lovely job of buying into what we're trying to do for students here with this no wrong door approach. So I also want to do a quick shout out that before we started this partnership with the city of Renton, OSPI, and some of the OSPI folks are on the call right now. OSPI gave us a grant that gave us some seed money to get this started. So thank you for that as well. But then we began working with MJ, who's not here today at the city, and they were wonderful in saying, okay, let's start some processes here. Let's put some money behind this and get something started. So that was a big accomplishment for us this year, is that the Renton School District is in partnership with this Health Commons, and then Health Commons has their own subgranting. And that type of funding has been able to keep some of the, not just the infrastructure in terms of technology, but the infrastructure in terms of the personnel that need to be together to get this thing started. We also are working with our own district. As you probably know, districts have the right to apply for Medicaid match dollars for some of the work. And so the other thing that we were able to do this year is meet with the people in the Renton School District that are in charge of doing that Medicaid match for us and saying, we really believe that this work that we're doing with our referral hub and the student health hub, et cetera, those things should be matched with Medicaid. So now the work that we do here is also a part of the applying for Medicaid match for the district. Any questions, things you'd like?
Thanks, Vicki. Yeah, and one of the things we're learning about this work is if you really want to sustain the systems and network and infrastructure, there really isn't one checkbook that can cover all the costs related to supporting the workforce and the technology and all the pieces that you need to operate the network. So it really is about getting this braided funding model or group of funding partners around the table. So we're making great progress on this. Still a long way to go in terms of financial sustainability. But big thanks to our funding partners for continuing to make this work possible. I'm going to pass it over to Celia to talk a little bit about some of our accomplishments related to particularly our IT tools that support our hub infrastructure. So if you can talk about, Celia, the accomplishments for our hub software this year, and then our new use of our insurance eligibility system, that would be great.
Definitely. Thanks, Adam. Hi, everyone. Celia McTeague with Health Commons Project. So happy to be here. So yeah, this has been a really big transformative year, I would say, for the hub. This year, we launched an entirely new hub software on the Microsoft Teams platform that is HIPAA and FERPA compliant. It has an entire dashboard, which is really a one-stop shop for our provider users as well as our school users, such as school counselors, to really review the referrals that they're sending in or receiving. It's really just an amazing resource that allows users to look at their referrals over time, and also allows them to track their referrals and see what is currently going on with them. So it's a really kind of great, bit of progress that we've been able to make over the past year, and we're very, very excited about it. We also had a really big change mid-year where we were able to kind of take advantage of Health Commons' acquisition of the One Health port to use their single sign-on tool to basically look up student insurance information to ensure that we are getting accurate information for a student to try and resolve any issues before we send a referral to a provider. This has really been an invaluable resource because there have and always are issues with insurance and clarifications to make. And so we're able to make those upfront before sending the referral to providers. So we're giving the provider the most accurate information possible. Yeah, but other than that, it's been a great year, and we've had 70 referrals in 9 schools, which is great to see, and it's great that we've been able to connect those students to our community providers as best we can.
Thank you, Celia. Hannah, I'm wondering if you can talk a little bit about some of the other IT tools from the One Health Port acquisition that we now have access to, and then feel free to then jump into some of our sub-granting work.
Yeah, thanks, Adam. Hello, everyone. So as Celia mentioned, earlier this year, Health Commons became Health Commons One Health Port. And so we are now in the process of engaging with the health data utility here in our state of Washington to really explore how can we as Health Commons, but also a network of providers here, leverage some of the provider services that organization can provide. So as Celia mentioned, we're now able to do insurance eligibility checks through one of the solutions that One Health Port offers. But there's also other things that we're exploring and that we hope to explore with you all. One of the features is really enabling our providers to access a complete clinical history on their Medicaid enrolled clients. And you can imagine any number of benefits from something like this. But, I think in the world that we focus on here, we could envision, it helping us improve care coordination with other providers in this network. And then also, providers can more quickly and easily send data to key stakeholders. For example, providers could expedite workers' comp claims by sending data directly to L&I through the health data utility. So lots of opportunity to come, and you'll hear more from us on that. So in addition to implementing these new services and new technological capabilities into the Student Health Hub, thanks to our partnership with the City of Renton, we also have funding for behavioral health and housing providers through the City of Renton Impact Fund. Just a quick reminder on this fund, because I know we announced it back in December, but the goal of the fund is to help our providers increase provider capacity and upgrade provider data infrastructure. Funding is really focused on our behavioral health and housing providers that are already on the hub or who want to join this network. Total funding available is $1.26 million, and the grant term is it's open and ends at the end of December of next year, so 2026 on the calendar year. I'm going to talk a little bit about where we've been with this sub-granting work for the last few months, and then you'll hear from one of our partners. All right. So we have been working with an initial cohort of 4 behavioral health providers who are active on the hub. Many of these providers were our early sort of co-design partners, so it's been a really lovely opportunity to chat and learn from them. Couple of takeaways from these, what we kind of consider these discovery conversations are really that operationally providers, and I'm sure you're all very aware of this, providers are receiving referrals from a variety of different partners, including the Student Health Hub, but also other school districts, other behavioral health providers, medical providers, the list goes on. Oftentimes, these referrals and the sort of corresponding data on the clients being referred are not automatically integrated into the electronic medical record or the health record system. Also, providers are to deliver high quality care. Providers are supporting many administrative and more manual tasks throughout the care continuum. Some of these activities can lead to delays in accessing care, or sometimes can sort of take away from valuable clinical time with providers. But they're part of the process of really making sure clients are engaged and have all of the steps taken care of for insurance, verification, billing, and et cetera. We've also learned that various factors, right, many not in our provider's control, really do have an impact on their ability to view whole person sort of data on the clients. But when we think about in the context of subgranting, right, we've heard from all of these different providers that they've been making investments in provider capacity and digital infrastructure for many years. And so the City of Renton Impact Fund is really an opportunity to co-invest in these solutions, and really is a good example of that braided funding that you've heard us talk about a little bit here. So over the last few months, just to sort of summarize, we validated that the Impact Fund will benefit our community providers and in turn Renton youth and their families. And we facilitated this sort of proposal review, development, and contracting partner process with some of our partners. We're excited to announce that we've executed our first subgrant agreement with Atlantic Street Center. Here to talk a little bit more about their project is Mei-Ling Morrison-Beals, the Director of Behavioral Health at Atlantic Street Center.
Great. Hi there. My name, Mei-Ling Morrison-Beals, she, her pronouns. So just a little background about Atlantic Street Center. We are celebrating our 115th year as an agency. And our primary mission is to support families and communities with raising healthy, successful children and youth through direct services and advocacy for social justice and equity. We have 4 primary programs at Atlantic Street Center. We have an early learning program, a youth development and education program, a gender-based violence program, and then our behavioral health program. Our behavioral health program, which I'm the director of, we are primarily serving children and youth ages 6 to 24, as well as their caregivers as needed. The young people who receive our services, they must have Medicaid insurance in order to meet with us. And we are primarily serving those individuals throughout Central and South King County. I'm here with folks from Renton School District, so we know that I tend to think in school districts. So we're currently in 7 different school districts. Seattle being the largest amount of largest population of students that we see, and then Renton School District being the second highest population of students that we see. We're also in Highline, Federal Way, Kent, and Auburn, and Tukwila. Majority of the young people that we are seeing are BIPOC children and youth. About 54% of the individuals that we're meeting with are Black African American children and youth and their families. And the services, the behavioral health program is really dedicated to reducing barriers to accessing care, which means that we're primarily seeing our participants in schools or in community spaces, their homes, and yes, at our office as well, but primarily most of our participants are being seen at school. And because a majority of our young people are under the age of 13, we are including their families quite a bit in the work that we're doing and in the treatment they're doing. And in Washington State, if you're under the age of 13, the parent is the one who's signing off on all the documentation related to behavioral health needs. If you're over 13, lucky 13 and overs, they get to sign off on everything. And so a challenge that we were facing in our program was getting signatures on all the documents needed throughout the course of treatment. Our intake process is generally in person with the family and the participant, and so we're not having necessarily issues initially getting those signatures. However, because we're in the community so much, because the folks that we're working with are the families, they work too during the hours that we're working. We're having a harder time connecting with our caregivers in person to get the signatures we're needing for our documents. We also use an electronic EHR, which means that there are some benefits to that, and that we are able to bring our laptops with us, set up our a mobile hotspot, get the computer going there so for people to sign. There's an app that some of our staff use, but most of them were not using for our EHR because of the user interface was difficult, and we weren't able to get the signatures the way that we wanted, because we still have to be with the caregivers or the participants in order to get those. So something that our staff has been asking for quite a while is can we figure out some electronic signature system? What's going to work with our EHR? What's going to work with our participants? Is it going to be, what's the interface? Could it be something that's easy to push out? And so we explored with our EHR to see if there was any possibilities of what they had to offer. And they have been they have a newer program that's available, but we weren't sure initially if it was going to fit or work for us. And with some testing and some opportunities to explore that based on the presentations that they're giving, we were really into the idea of having an opportunity to use this system called On Call, that the EHR creates an app that allows for our participants to download the app, and they would get push notifications for signatures or appointments. They would be able to access documents and appointment information on this app. However, we really wanted to be able to test it and to make sure that it would work for us. But there's quite was quite a large upfront cost that wouldn't allow us to actually test it. We'd have to actually purchase it, go through the whole process of building out this app and make sure, and then at that point use it. So it's a lot of money to put up front for something that we weren't 100% sure was going to actually work for us. Since then, the EHR has made some updates and some improvements to the service that we're really excited about. And now that we're able to partner, we're actually able to or partner with you all. We're actually able to get this this program to help reduce those barriers to getting the signatures or having our families have access to documents. It's going to reduce time that our therapists are out in the community trying to get these signatures and connect with their families. It will give greater access to both our participants and their caregivers to have direct access to documentation, as well as opportunities for us to revamp some of our systems in place. We're really hoping to be able to revamp our intake and assessment process to make it more supportive of our families and more client-centered, and give them the opportunity to do things ahead of time so that they're not having to spend as much time in our office, knowing that their time is precious, and wanting to make sure that we're supporting the whole family as well. So I think that on the screen you see that there's some of our challenges are listed out. One of the big things is making sure that we're getting, the signatures and documentations for our families are really important, but there's also a compliance part of that too, which is always really fun for our programs. We'd really like to focus strictly on the clinical work and everything else, but we also need to make sure that we get our signatures. And so that's going to be a huge benefit as well, to be able to have an opportunity to use Credible on Call and get that process going where we wouldn't have been able to without this support. It's going to increase opportunities for more clinical focus, since we're not going to have to focus on worrying about making time for families and participants to do signatures and all that fun stuff. So that's very quick run through of a little bit about our program and what's been going on for us and what we're really hoping to get out of this partnership.
Thank you, Mei Ling. Yeah,
Mhm.
it's great to hear the background on your organization and how this particular initiative will help you spend more time serving the kids and families that we're all trying to take care of together. So I know the city is really excited about the opportunity to use this fund to, help community providers modernize their businesses and upgrade their technologies and systems so that they can serve the community. So yeah, we're really excited to have this as a first project. So congratulations. All right, so now we're gonna sort of transition from talking about what we've accomplished together from during the 24-25 school year to looking ahead to next school year. Davina, I'm going to pass it over to you to talk about where we're headed with our behavioral health work next year.
Great. Thank you, Adam, and thank you, Mei Ling. So specifically for behavioral health, next school year, we'll be focusing on expanding the intelligent matching system to all 26 schools. So currently, we have 9 of our schools have access, so it will be accessed for all of our schools, and we will continue to add new provider partners.
Thanks, Davina. And can we give a special shout out to Charlie Health, I think is on the call today, which, if I'm not mistaken, is going to be one of the new providers we're going to add to the network. You want to, Davina, tell us a little bit about Charlie Health?
Yes, sure. So Charlie Health, I'm so excited they reached out to us. So Charlie Health has been a telehealth provider offering intensive outpatient care. And so we're really excited to be able to offer this for our students who are 11 years old and up. And so we're excited to be to be able to access this, because not only do they offer individual counseling, but also family counseling as well as affinity groups. And the affinity groups can be accessed for free for some of our students as well. So we're really looking forward to this partnership and being able to have another provider be able to serve our kids. So really appreciative of all of our providers and being able to have the options for our families, really based on the individual need and what works for our families. So very happy to have all these partnerships in place and continuing to add partners to our list. So thank you all so very much.
Yeah, all about keeping a strong network. So we're going to keep looking for more providers to add in the coming school year. And then we're also going to be looking for opportunities to add a new service type. So as Davina talked about at the top, if we go from that sort of North Star vision to where we've been focused to date, it's really been sort of exclusively focused on addressing the youth mental health issues at Renton School District. We're now, we understand the larger goal, which is how do we get to this more whole child service model? And so the next service type we're planning to add in the coming year is housing. Vicki, do you want to talk a little bit about the housing program and sort of how this fits in with some of the existing work around the McKinney-Vento program?
Sure, thanks. So as you heard me say earlier, the district's overarching goal is that we remove barriers and pursue outcomes that enable all students to realize their potential. And we know that in Renton, many of our families are struggling with homelessness. We have 712 students that qualify for McKinney-Vento services, meaning that they qualify under that they don't have a fixed and stable nightly residence. And as you can imagine, that makes their outcomes less than desirable in terms of their ability to access their education. So we have Quinice on the call, actually, who is our McKinney-Vento liaison. And we've been working with these families all along, but one of the things that we obviously can't do is just house them. That's not something within a school district's purview. So we are super excited to start working with some people that could help us manage. We're not suggesting that we're building homes. We're suggesting that there are ways to manage moving through finding somebody who can help us to navigate this issue and get families housed, et cetera. So we are looking forward to bringing on this as a potential service model for our kids, because it's just hard. There are times that I actually get calls from families saying, look, is there anything that you can do? And I'm really looking forward to being able to say, yes, there is something that we can do. So this is, I'll let you talk a little bit more about what it's going to look like, or as much as we know about what it's going to look like, but it makes sense to me that it's the next big need.
Yeah, thanks, Vicki. And I think there's such a great opportunity to work together with Quinice, who's already, working with local schools around how to identify these eligible students in the McKinney-Vento program, and then do that intelligent matching that we're doing through the Student Health Hub, through our behavioral health work, and make sure we can match folks to the right housing navigation services, and ultimately get them plugged into the right housing services, whether that's eviction prevention or rapid rehousing or temporary shelters. So we're still in the early design and development of what this program and pathway is going to look like, but we're making quite a bit of progress, and we're very optimistic that we're going to get at least a demonstration project in place in the coming school year. Vicki, do you want to just talk quickly? I know MJ, Mary Jane Van Cleve from the city, isn't joining us today, but I know she's super excited about looking forward how to add a third service on to the hub with some of our recreational providers. Do you want to talk a little bit about that for the group?
Sure, it'd be a pleasure. So one of the things that Davina and my department, I'm the director of student support. I forgot to tell you that, but my department has been saying from the beginning is that we really want a, a full kind of upstream services for kids. We want to see kids engaged in activities that bring out their potential and get them excited and plugged in and learn about who they are and all of those things. And so, as you know, schools offer a lot of activities. So we might have sports or after school clubs or things like that. But there are other activities that the community offers that we want to figure out how to connect kids to. So we're working on now saying, hey, now that we've got, some activities at the school that kids are connected to, what would it look like for us to say, oh, we didn't have the right fit for you, but all kids should be allowed to connect to something that's going to maximize their potential, get them excited, etc. So what could that look like? And so the fact that MJ is in charge of Parks and Rec at the city, and we already have a partnership with her around behavioral health, it was a really lovely next fit to start dreaming of what would it look like to also add to our hub some community recreation services or clubs, or I always use as my example that some kids are going to eventually connect to like aquarium what's the word now? I can't think of it. The horses, anyway, whatever that word.
Equine. Yeah.
Like those kids, that's going to be the fit for them, that makes them just live. But we don't offer that at a school, but kids still could use it. And if we connected it to what they were doing with their whole life, like school is a big part of their life as well, wouldn't that be something for their kids and their mental health and their behavioral health? And how can it all work together to add to this whole child? So we're just in the beginning of what would it look like? How can we bring that on next? But it fits so nicely into the overall mission of what we're trying to do, and builds assets for kids. And so that's our discovery, our next excitement.
Yeah, so hopefully more to come on that as we start to learn, in landscape what the services are that are already available in the community and how we can start to put that together on the network. So very excited about that. So in terms of hub sustainability, this is some of the key activities we're going to focus on next year. The funding piece of this is critically important. So we've got the city as the lead funder, but we are going to be working together to bring that coalition of funders around the table to make sure we can continue to braid funds and make sure that the network is sustainable. We are also looking to shift from what's been sort of a short-term governance and leadership structure to now putting more of a long-term governance and leadership structure in place. So we actually talked today with the city about, how could we bring together a community advisory board that's very Renton focused and has, the authority to make decisions and help align priorities around, what services and providers we're adding onto the network. So we intend to make progress on that in this next year. Celia, do you want to give us maybe 30 seconds on some of the training tools that you and Lane are going to be working on?
Sure. Yeah. As part of our continuous improvement process, as well as in consideration of the fact that we're going to be in 100% of schools next year, we of course want to make the system even better. So we are planning to develop some asynchronous training tools to help our providers as well as our school users stay up to date with kind of the new technology, the new features, and just generally how the hub process works. I think that asynchronous training will really enable school counselors and providers to make the most of their time by allowing them to do it on their own time wherever they are, and really just help their capacity, which we know is already high. We're also planning to add some new features, some new filtering capabilities, addressing kind of status update requests. We know that's been something that our providers have kind of mentioned to us. We've also sent out some surveys. So if we have some providers on this call and you've received a survey because you're a user on the hub, please fill it out. That really allows us to help pinpoint improvements for the future. And some other exciting, updates for next year is we're partnering with Cambia Health and OHSU to conduct an independent evaluation of the effectiveness of the hub, which we're quite excited about. And then, yeah, all the work around the housing pathway. It's going to be, a lot, but we're working on some co-designs, some work groups to really bring that to fruition, because we really think that is going to be a huge help to the students in Renton.
Thank you, Celia. And then Hannah, you want to round us out with just talking about where we're headed next year with our subgranting work?
So looking ahead, we will continue to support our initial provider partners with the proposal development, contracting, and implementation process. And we're also very interested to hear from other behavioral health and housing providers who have a project in mind, right? Something that maybe you're thinking about that relates to provider capacity, provider data infrastructure. You heard an example from Mei Ling. If this is sort of turning some gears for you and your team, we would love to hear from you. I'll put my email in the chat, but go ahead and reach out. And over the next few months, we'll start to put together sort of a second cohort of providers, and we'll help with the proposal development and end-to-end process. So I'll put my contact in the chat. Please do reach out if you are interested in accessing some subgrant funds. Thank you.
Thank you, Hannah. And we can now open it up for questions and discussion. A few prompts just to kick off the conversation. We'd really love to hear from you. We've laid out some ideas for where we're headed next year, but what are we missing? What should we be doing differently? Are there other partnerships or collaboration opportunities as we think about adding new services, new providers onto the network that we should be exploring? So would love to hear from the group. Or does anyone have any questions about the Atlantic Street Center project, or any ideas that you all might have about other impact fund projects that...
Hey, everybody, Brian Frank. I'm a family medicine doctor. I'm going to be doing some evaluation of the project. First of all, just a huge fan of what you all are doing. I think it's really revolutionary, and it's timely anyway. It's fantastic. I actually have a question for the group. We're going to be talking about, we're going to be defining success by a number of metrics and trying to identify what is success in the early stages. But I'm curious from anyone, like, if this was going to be a successful program, how would you know?
No, it's a great prompt. Any thoughts from the group? And that can include like Vicky and Davina. Feel free to chime in there, or other providers. How do you, when you look at a network and sort of a collaborative infrastructure, what does success look like from your perspective? Great question.
So I don't know, Dr. Frank, if this is going to give you the answer that you're looking for, but one of the things that really compels me or drives me, I don't know the right word for it, is that when we look at our healthy youth surveys that are done every other year in the state of Washington, the Renton School District students have been telling us that they are extremely anxious. And that really breaks my heart, that they, like, something like 60% of them say that they have had to stop doing regular daily activities because they're so busy worrying about things. And I know that that's not something that a school on its own can respond to. And so that really drives me, like, how do we make it so that students in Renton feel less anxious, feel more able to move forward in a healthy and happy way? So to me, that's how all of these things fit together for me, is, can we as a community make this a place where kids feel secure and safe and happy? And so I'm not sure what the metric is. I'm always looking at that healthy youth survey and saying, okay, can we move that needle? And feeling really like there's some things that a school district can do to move that needle for sure, but it takes a much bigger village than just us to move that needle.
Thanks, Vicki.
Very
There's
much.
others,
That's fantastic.
other hopes and dreams from the group.
Hi, this is Mercedes. Can you hear me okay?
Yeah, we can hear you.
Hi, so I'm thinking that a good way to measure this would also be children are not an island. They have family members also who go to possibly other schools, elementary schools or high schools. So it would be good to also be inclusive of family members who are in schools.
Yeah, great point, Mercedes. And do you have maybe specific examples of what you're thinking of how to include them in schools and including them in this work?
So I do a lot of work around communities that are immigrant, refugees, and migrant. And so many times families have a big challenge understanding the system to begin with, taking care of the first needs, education, health, housing, all of that. And sometimes it's very difficult for families to, focus on the one child that needs to be in high school or middle school or elementary school. Sometimes these families have more than 3 members that are going to school at the same time, and they having a hard time dealing with everything. So for me, it's important not to just pay attention to the student, but also somehow pay attention to the family as a whole. Because if the parents and the other children are not well, chances are that high school student is not going to be well either. Thank you.
Yeah, beautifully said, Mercedes. And I think, it's sort of one of the limitations oftentimes of the school is, we're right now even just struggling with the idea of how do you get to sort of whole child service model. But what you're talking about, which I think is a another aspiration or vision is, yeah, how do you get to serve that whole family? Not within the school maybe, but also within the community. So that's you're right on track. Other folks, any reflections as you think about other sort of services that we should maybe be adding on to the hub in the future besides housing, recreation, other ideas, other provider groups that we should be talking to, or other partnerships or collaborations within Renton or King County or Washington State that we should take a look at?
I think one thing that we've discussed in the past, and I want to continue to keep in the forefront of our minds also, is mentorship programs, right? So how do we help our students or our kids have the positive relationships or somebody that they can connect with? There's a question that's asked in our screener and in the Healthy Youth Survey if there's a positive adult that they trust when they have a need. And sometimes our students say no. And so if we can create these opportunities to help our students who may be struggling or don't have that positive adult in their lives for whatever reason, trying to find intentional ways of linking them to a positive adult figure.
Yeah, I love that. Davina, I'm wondering, do we have any of the mentorship providers on the call today, or like Atlantic Street? Is that a service that you offer, or other folks?
Hi, everyone. Jennifer Huddleston from Charlie Health here. Thank you so much for allowing me to join. I know Chelsea has been in conversation with everybody previously, so I am honored to be here today. Yes, this is a service that we do provide for students that are in our program. Every student that comes into our program is matched with a peer support. We kind of call them a approachable friend or buddy. And usually this is a person that has gone through the program, so can really speak to what their experience will look like, and really has someone to go to that is a safe space, and again, just a mentor to them outside of the therapy that they're receiving. After they graduate from our program, they then have access to our entire alumni portal, which are ongoing free groups that meet every single month. Groups like Dungeons and Dragons Night, we have book club nights, we have gardening clubs, knitting clubs, we have meetups for adults in our program. So we have so many opportunities for connection for students that are in our program, and we continue to expand on what those offerings are. But connection is the core of what we do at Charlie Health. It's why we curate our groups specifically to the individual, and why our group size is so small, to really ensure that connection from the moment they enter into our program. And then we sustain that upon graduation and well after that. They can actually access our alumni services until they age out of our program. Right now, we accept folks up to age 50, so it can really be a lifelong resource for them.
Wow, thanks, Jen. Yeah, thanks so much for sharing that. That was not a service that I was aware of. And I see Brianna dropping in the chat that Neighborhood House offers some youth advocacy programs that have a mentorship component as well. So yeah, it's this is a great space for all of us, I think, to learn about, what are some of the best practices and service models that providers are offering, to make sure that kids are getting the help and the social support that they need. We really appreciate everybody taking the time to just spend with us today. Let us share a little bit of celebration around the accomplishments of this school year and where we're headed next year. We will certainly plan to host 2 learning network sessions next year, one at the end of the calendar year and one at the end of the school year, to keep bringing this group together and sharing the progress that we're making to serve kids and families. So much appreciated. Please don't hesitate to reach out, and have a good rest of your day.
Thanks, everyone.
Thanks for being here.
Thank you.